Dear Minister, distinguished guests, colleagues and friends, ladies and gentlemen, it's my pleasure to welcome you on behalf of the steering board to the second edition of Uppsala Health Summit, this time under the heading A World Without Antibiotics. My name is Anders Malmberg, and I'm the Deputy Vice Chancellor of Uppsala University and the chair of this steering board for this initiative. Antibiotic resistance is presently one of the most severe threats to human health and healthcare as we know it. Medical conditions that have until now been considered relatively minor may suddenly become life-threatening. Still, the year 2015 might prove to be a turning point. Last week, in Geneva, the World Health Assembly at long last adopted a global action plan. This document is a welcome and important starting point, but we should realize that it is just the beginning. Uppsala Health Summit 2015 will focus on concrete action. We know what is at stake. We have to change the way we use antibiotics, and we have to do it now. To make the global action plan materialize demands the engagement of many different stakeholders: doctors, patients, the pharma industry, healthcare providers, donor organizations, politicians, researchers, farmers, consumers, at the local, national, and global level. This work must start here and now, and that's why we are assembled in Uppsala today. The aim of Uppsala Health Summit, generally, is to bring some of the best minds in the world to Uppsala to address challenges and dilemmas in order to improve utilization of medical advancements so that health outcome can be improved in all parts of the world, despite limited resources. That is why you are selected to be here. Uppsala Health Summit is an arena where different perspectives and approaches, medical, economic, ethical, are combined, in this case, in order to define how to take the next step in combating antibiotic resistance. The summit is a place where you can listen and learn, but it is primarily an arena for active dialogue. Throughout these 2 days, you will be invited to share your experiences, views, and ideas in plenary sessions, around the tables in this room, in the workshops, and during breaks and meals. Uppsala Health Summit should be an arena for frank and open dialogue that brings new insight and promotes new action. Be inspired by the keynotes and plenary discussions, and do bring your views to the workshops. We propose one rule of conduct in order to promote free and open dialogue. What is said in the workshop should indeed be widely spread, but who said what should stay in the room. Conclusions from the workshops will be presented and discussed in plenary sessions this afternoon and tomorrow afternoon. And the team that has prepared the program and the pre-conference report will also prepare a post-conference report with the main conclusions from all sessions. A draft will be sent to you before we finalize and distribute it. Uppsala Health Summit is organized in collaboration between a number of actors in Uppsala and Sweden. There are 5 founding partners that I would like to mention here, and then 3 more partners that have joined lately. And the first are the 2 universities in Uppsala, Uppsala University and the Swedish University for Agricultural Sciences, the SLU as we call it. It's the county council or the region of Uppsala, which is the major healthcare provider here, and it's the city of Uppsala, and it is a local public-private network called World Class Uppsala, a very modest name, but it's an organization that helps organize great meetings like this one. These have been joined also by the National Veterinary Institute, the Swedish Medical Products Agency, and Vinnova, which is the Swedish Innovation Policy Agency. Uppsala Health Summit also gratefully acknowledged the support from a number of sponsors listed in the program, and in most cases being present in the exhibition hall outside this room, I believe, and also in this room as participants. I would also like to mention here that Uppsala University is right at this very moment setting up a new major initiative, which we call the Uppsala Antibiotics Center, the UAC. This center will encompass research, education, and information with broad participation from a wide range of fields and disciplines across the university, of course, and will also will also involve other actors in Uppsala, including those mentioned, like the SLU, the National Veterinary Institute, the network REACT, and a number of biotech companies here. So this is something we are very excited about. I also would want to take this opportunity to thank the Program Council and the workshop groups who have prepared the program, together with our project leader, Madeleine Neil. And the Program Council has been chaired by Dr. Thomas Tengdén, who you will meet later, of course, and has consisted also of Stefan Pettersson, Anna Sorset, Anders Karlén, and Alexandra Waluszewski, all from Uppsala University, joined by Susanna Sternberg-Leverin from the SLU and Joachim Larsson, University of Gothenburg. So a big thanks to all of you already now. I think it's thanks to your work that we can look forward to what seems to be 2 really exciting days. I will now give the floor to our moderator, Cecilia Garme, who is a political journalist with a PhD in political science from a very well-known university in this city, and is an experienced moderator of both Swedish and international meetings. But first and again, to all of you, on behalf of the steering board, a warm welcome to the 2nd Uppsala Health Summit, hereby declared open. Thank you.
Hello, everyone. It's very exciting to be here. There are a few medical issues that are so intertwined with policymaking as the issue of antimicrobial resistance and how to fight it. Because you have all the big political themes here: social justice, equality, the classic problem of the tragedy of the commons, and theories of action or non-action can also be tested in this field. So what is happening right now is very exciting. Over the last weeks and months, world leaders have turned their attention to the AMR question in a new way. Look at this.
The reason I called you guys in here today, before the meeting, is I wanted to talk about an issue that is of great importance to America's public health and the world's public health, and that is some of the problems that we're having in antibiotics becoming less effective, and the need for us to deal with these drug-resistant bacteria.
I think this is a very serious threat. I mean, we are in danger of going back to the dark ages of medicine to see infections that were treatable not be treatable, and we would see many thousands of people potentially die from these infections. So it's a very, very serious problem, and one that we absolutely have to grip. We have to grip it globally, because this is a problem that's going to affect every country in the world.
Drug-resistant bacteria are one of the most serious public health issues that we face today. They cause tens of thousands of deaths, millions of illnesses, and that's just in the United States, and the numbers are sure to climb unless we take some very clear, concrete, and coordinated action.
Please join me in welcoming Dr. Angela Merkel.
Und ich glaube, hier kommen wir an ein Thema, das von ausschlaggebender Bedeutung für die Menschheit insgesamt ist, sowohl in den entwickelten als auch in den weniger entwickelten Ländern. Es geht darum, dass wir die Wirksamkeit der existierenden Antibiotika sichern und sie auf die ausschließlich notwendigen medizinischen Anwendungen beschränken, und zwar nicht nur für den Menschen, sondern auch für die Tiere.
Yeah, and the last one, as you saw, there was Angela Merkel speaking 2 weeks ago at the WHO when the Global Action Plan was adopted. So it feels almost like we're having a moment now that the climate change question had in 2006, when there was Al Gore's film and the Stern report. It's breaking the ceiling now, these questions. Some practical matters before we get started. Mobile phones, keep them turned off, or turn the signal off if you want to keep it on in order to tweet. If you want to tweet, use that hashtag. Internet, free, UKK_guest. About your name badge, that's your entrance ticket to all conference room, and also to a ticket for coffee, lunch and dinner, so wear it at all times. We have a film team from Uppsala Health Summit producing a film for the conference for later streaming, and they will interview you during the breaks. And we also have our own photographer here somewhere. So if you don't want your picture taken, just put up your hand. He's very kind. In case there is a fire alarm, you will be informed by an automatic system in English and French. No, in Swedish. in English and Swedish. And then please follow the green exit signs. But hopefully nothing will happen, because the last time there was a big fire in Uppsala was in 1809. So you're pretty safe, I think. I'll give you more practical details as we go along. Before we get into more detailed framing of the issue, we have a special guest. It's a policy-making guest, the Swedish Minister for Healthcare and Public Health. We had a change of government in Sweden in September last year, so he's fairly new on his post, but he landed running. And there is a long record for Swedish Ministers of Health to promote strong policy making in this field. So welcome, Gabriel Wikström.
Ladies and gentlemen, first of all, thank you for this opportunity to welcome you all here today to Uppsala and to this summit. A summit, I trust, of open and frank discussions, something you experts and scientists know is so important. I, of course, stand before you, experts and scientists, as a politician, an international species with its own resistance, you may think, to openness and frankness. But they are, ladies and gentlemen, exactly what we need. I think on AMR, we need all the openness and frankness that we can get and give. So to be frank, sometimes there is an alarming lack of knowledge and political commitment on AMR. And Alexander Fleming, of course, in his Nobel lecture 70 years ago, warned of the dangers of for the miracle of antibiotics from what he called the ignorant man. Warnings which have mostly gone unheard. So AMR is not a future threat of Fleming's day. It is here. It is now, and it is among us. Every year, it already kills 500,000 people worldwide. The costs in human and in financial terms are already huge. And a heavy price for poorer countries who can least afford it. We hear that if we are not moving forwards, and superbugs are, then we are not standing still. We are instead heading back to before Lister and Pasteur, back to when infection was a routine killer. Because of ignorance, yes, but also because of convenience, laziness, perverse financial incentives, and sheer bad luck. A depressing list, if nothing is done, but all of which, given the will, we can start dealing with, and which we must start dealing with now. Because now we do see some real light. As you know, and as we have just heard, last week in Geneva, the WHO finally adopted the Global Action Plan on AMR. Just the first step. Next, it must be implemented, but a real first step. And we politicians must help keep up the momentum, because health ministers and other leaders have both the possibility and the responsibility to make a difference. So in Geneva, on the initiative of Sweden and the United Kingdom, we founded an alliance of champions. Among the signatory nations are both the United States and China, but also several smaller nations. An alliance to promote political awareness among our fellow ministers and heads of state for the real engagement and leadership that fighting AMR needs. 14 health ministers have now signed a call for action. A call for, by no later than 2016, a high-level meeting in the UN General Assembly. It also, very importantly, commits us to implement the Global Action Plan. This is a fight that Sweden has, in fact, been long committed to, and we will continue to be so, both through specific priority actions and our political commitment, such as with surveillance. I do not need to tell you that even with AMR at alarming levels in many parts of the world, we still lack the data. There are very worrying limitations and gaps in global surveillance. So in December last year, an international meeting on AMR surveillance was held in Stockholm. It was a success, and the talk and ideas did lead to action. We are now collaborating closely to help the WHO with the building blocks needed. And last week, Sweden's Public Health Agency delivered the first draft of a comprehensive manual for the new global AMR surveillance program, a program that Sweden is helping WHO to build. And my government fully supports a strong WHO, ladies and gentlemen. It seems self-evident that only a strong World Health Organization can deal with global threats to health. An organization that must and will adapt and evolve. And an organization that will support member states in building strong and resilient health systems. Because without such health systems worldwide, as Ebola taught us, we simply cannot fight global health threats like AMR. Because no one can mitigate and manage this threat alone. It is beyond individual countries, and it is beyond just the health sector. Fighting AMR needs a great, unprecedented, but very possible effort in our globalized, interconnected 21st century. A true One Health approach across the board and across all borders. You come here to Uppsala, ladies and gentlemen, from very different parts of the world. You also represent very different stakeholders, which makes you your own experience and your own perspectives of the greatest value to us all. Because for the Global Action Plan to work with the many complex challenges AMR involves worldwide, will involve collectively and worldwide all our efforts. For the actions outlined to make a difference, then all of us need to focus on our different contributions. And we all need to look closely at the Global Action Plan, because the Global Action Plan needs all of us. So in your discussions, do look at the framework for action. Look at the proposals for the Secretariat, for the member states, and for other national and international partners. How do you think you can prioritize these proposals? How do you think you can take them further? What is needed at the local level, at the regional level, and at the national and global levels? Who must be involved? And globally, how can we best approach tackling the differences in situations and needs worldwide? Talk, of course, is good when it leads to ideas. And when, as I mentioned, those ideas lead to action. Because it is action that we need from us all to build this new momentum and drive the fight back against AMR. So, ladies and gentlemen, I wish you all the very best in your frank and open discussions in the days ahead. I'm very much looking forward to hearing the outcomes. So once again, you are, all of you, very welcome. Thank you.
Thank you, Gabriel Wikström. I believe we have to go on.
Yeah.
Can I just ask you one question?
Absolutely.
Yeah, and then I will have to ask you to leave because we're already, behind our program.
Much more important discussions.
No, but since you're here, I want to ask you one thing. Because this question is a lot about finding money, right? And I know you're not foreign minister, but I want to ask you anyway, are you lobbying for channeling money for the purpose of fighting antimicrobial resistance through the Swedish foreign aid program? Do you think that would be a good idea?
Well, it's a very interesting discussion, and a discussion that we are having within the government. And I believe that one of the most important things, as I said in my speech, is to build resilient health systems.
Yeah.
And this could really be a main focus for much of the Swedish foreign aid. So it's definitely an interesting issue.
So next time you see her, what are you going to say?
Next time I see the foreign minister?
The foreign minister?
Well, I met her state secretary yesterday, and she's very engaged in this question. So we speak a lot about it all the time. Next time we will probably speak about what to push for at the high-level meeting in the UN next year.
Yeah, good. Well, good luck. Thank you very much for being here.
Thank you.
We also have greetings from Brussels, the EU Commissioner for Health and Food Safety, Vytenis Andriukaitis.
Ladies and gentlemen, thank you for giving me a chance to address you, although, regretfully, I cannot attend in person. Indeed, I would have liked to be there with you to discuss an issue which I have identified as one of the priorities of my mandate, antimicrobial resistance. As a medical doctor, I have often been confronted with this issue. I know how important it is to preserve antimicrobials, which are an essential tool to our disposal to fight diseases. I also know that the effectiveness of this tool is being eroded, notably due to overuse and misuse. The emergence of resistant bacteria is making us unable to treat patients with certain severe infections. These infections are spreading especially in hospital environments and are a major cause of concern. Increased resistance to antimicrobials, especially antibiotics, has a direct impact on human and animal health. It affects environment and finally carries a heavy economic cost. All this signals and emphasizes the need for effective and coordinated efforts to combat antimicrobial resistance. The One Health policy approach is necessary. We must unite our efforts and adopt a holistic approach within medical and also veterinary communities, sending the right messages on the use of antibiotics. The European Commission launched its 5-year action plan to combat antimicrobial resistance back in November 2011. 3.5 years later, important progress has been made in Europe. For example, 2 initiatives related to antimicrobial resistance are currently passing through the European legislative process: a proposal on medicated animal feed and another on veterinary medicines. In addition, the action plan has increased international awareness of antimicrobial resistance worldwide as public health concern, and as our action plan draws closer to its end in 2016, I intend to convene a high-level conference to thoroughly assess what further actions should be taken to step up the fight against antimicrobial resistance. Let me conclude by saying that as a medical doctor, I am strongly advocating for the responsible use of antibiotics. And as a Commissioner for Health, I am committed to fighting antimicrobial resistance during my mandate. I trust I can count on your support both now and in the future. Thank you.
Yeah, those are strong words from the EU Commission.